So on today's agenda, we're going to learn what you need to know about credentials. We're going to learn about service members, veterans and families, essay problems, and at the end, we will have a credible trivia game where two staff will win a virtual Amazon gift card. So we are going to start off today with credentials, and Mitzi is going to actually go over credentials with you all. Mitzi, are you ready?
I am. So I just want to thank everybody for joining us today. It looks like some folks are still popping in. So as you're popping in, please be sure you're putting your name in the chat so we have a record of you being here. You know, as always, this is informal. So feel free to drink your coffee, your beverage, whatever, eat your breakfast, whatever. We encourage questions. We're monitoring the chat. So if you got questions, you can put them in the chat. We're also going to ask you, hey, do you have any questions? It's your time to just speak up and ask a question. So we want to be sure that you're getting everything possible out of our EHR. So no question is stupid. No question is dumb. Every question is valid, is important. And if you have it, someone else has it as well. So let's ask those questions and we'll get everything answered. So credentials, this is really timely. A lot of people's credentials expired on June 30th. All of our licensed staff, all of the QMHPs, they all expire, every last one of them, June 30th. It drives Shannon Clark crazy because she's the one who has to go look them all up, verify them all, and get them into the system before July 1st. As if they're not in there, then we will see employees, licensed folks, anything that's credential driven in Credible, and we'll talk about what that is. People have a hard time doing their job in Credible because their credentials aren't updated properly. So it's a lot of work. We have a lot of credentialed people because of the business that we're in. So what I just had said that we have credential driven services. So there's a list of forms here on front of you. And I believe there's actually more services that are credential driven than what you see on this list. These are just the ones that I could think of off the top of my head, doing a little quick research to find some, but I believe there are a few more. So we have these services here, like crisis stabilization, medication management, the peer services, injection administration, different assessments, all sorts of different little services here. We have them credential driven because by regulation, only people with the specific credentials listed are allowed to provide that service and to bill for that service if it's something that's billable. We also have, in terms of our peers, we want to be sure that only our peers are creating these peer support services because we use those for state reporting purposes. And if we have a employee who's not a peer complete those services, then our state reporting does not look so good. So we want to be sure that only the peers have access to those services. And again, we're going to be starting some billable services with our peers. And again, that's going to control billing as well. So what happens, I wonder if anybody, I'm going to ask a question, if anybody can tell me what happens when your credentials expire or they're not put in Credible, and what, if anybody knows what happens. I know this has happened to many of you, so some of you we're going to be interactive. Tell me what happens. Shane Maloney, you aren't able to make appointments on the schedule. Exactly. If you don't have the credentials, you can't see that service in your schedule drop down. And Shane, you're central scheduling. So in central schedulers or any of our support or administrative support staff who might be trying to schedule appointments for you, they can't schedule those appointments because they can't see that service in your schedule drop down. So that's one thing that happens. What is another thing that might happen if your credentials aren't in properly? There's another issue that we run into. If anybody knows what that one is. Nope. Nobody. Payment. Sandra Allen's, yep, payment. Your credentials aren't in properly. We can't bill. Brittany Csack says you can't schedule billable services. There's also another one, and I'll just go ahead and let folks know, but it's the dreaded red X can pop up on a service. So what happens in some of these cases here is, like we said, you can't see them on your schedule drop down. However, if you're using a form groups do not honor credentials. They kind of turn a blind eye to credentials, and you can still access these services here if you're using a form group with these services. We have that issue with some of these, with the assessments, like the CIA assessment. When our licensed staff, our licensed clinicians complete a CIA assessment, they're not just going to their schedule and grabbing a CIA assessment. They're actually grabbing a form group that has the CIA clinical assessment, a medical assessment. There's other, I know off the top of my head, I can't remember what they all are, but there are 4 or 5 forms associated with this assessment form group. So if somebody's licensed credential, so let's say I'm the LCSW, I'm completing a CIA on somebody, my LCSW expired on July 30th, and that's, I'm here in August trying to schedule this appointment, trying to complete this appointment today. I can go ahead and see that form. I can complete that form, and then when I finish it, it will have a red X on it because Credible is not going to let me bill it out. And if my credential is not up to date, that form is actually invalid. It's against several of our regulations. It needs to be done by somebody who is licensed. And if my license has lapsed, that assessment on this client has to be done again. If it's just an error in getting it into Credible, I didn't turn my credentials in properly or on time, they will be, Shannon will enter them in retroactively, and then we can reprocess those visits. So what we really want to be sure is that what folks are doing is that they're paying attention to their credentials. Like we said, everybody with the QMHP, everybody with an LCSW, LPC, LMFT, they all expire every June 30th. You should all know that. So there's really no excuse. So we want to be sure that when you get your new, you have to, pay for your updated license. You might have to fill out a small little application. Sometimes you might have to turn in your CEUs, whatever the process is. Please be sure you do that timely and that you send your updated license to HR. HR will send that stuff along to Shannon Clark, who will verify things, and she goes and she updates Credible accordingly. So that we want to make sure that you get that done early and as soon as you can, so that it can be in before July 1st, so that there's just no gap or lapse in services whatsoever. And it's a lot easier on Shannon Clark. The earlier she can get them, the easier it is on her. People like the residents, your supervisees, nurse practitioners, RNs, LPNs, and the physicians, MDs, DOs, you're all your credentials are all over the place. They expire exactly, a year or 2, maybe 3 years, depending on the credential of when they began. So they're not all on that July 1st kind of time frame. So again, please be sure that you're turning those updates into HR timely. For resident supervisees, I think your letters of agreements actually last quite a few years, but you do need to be on top of those because they do expire. They do have an expiration date on them, so please pay attention to those. Now, in Credible, we want you to be sure that you're looking at your credentials regularly. that you're looking at the credentials that appear on the services you're completing. So you can see your credentials on your client, on your employee profile. Shannon, are you in charge of the PowerPoint or am I? Oh, thank you, Shannon. I didn't know who was actually running it. So thank you, Shannon. So on Incredible, on your profile, you can see your credentials listed right here. Is like right near the top, right underneath your name. So Shannon's got hers here. She's a BSW, she's an LCSW, she's an MSW, and she's a QMHPA. So you want to be sure that these are always current, always up to date. If your license or your credential expires, so if Shannon's LCSW expires or her QMHP expires and it doesn't get updated, Incredible, these actually drop off and you won't see them. So be sure that you're always seeing them here. Let's see. If you don't see them, please contact HR and Shannon Clark immediately to see what the issue might be. Did you turn your license, your updated license in? And then, you know, we can do that troubleshooting and make sure things get updated, and any services that might be hanging out there with the red X, once the information gets put in, we can go back and reprocess those so that they can get approved and on for billing. Any questions about the credentials? You know, Shannon, you're here. Is there anything that you wanted to add about credentials? I mean, because you're the one who has to live and you eat, live, and breathe these things. So
just you stress the importance of the credentials, and some like our QMHPs and LPCs and LCSWs, they expired the end of June, so they're updated. However, we do have other credentials that do expire each month. I run the report. I don't do it exactly on the first because I do have some late stragglers, so I try to run the BI report to see who's not updated about the second or the third of the month. But it is important that you do make sure your credentials are updated, and I run the license lookup search. So however, please send the updated license to HR, but I do also verify through license lookup. As soon as I receive from HR, I still verify to make sure that it's updated and everything. So it's done both ways, but please, it's important. And sometimes, like Mitzi said, at the end of June, and I'm checking, it's a beast. It's because every day I have to check because people are updating every, you know, it's a lot. So the earlier you get in, it's better. It helps us when it comes to Credible and having those updated.
I think I at least, you know, I'm a QMHP. I'm actually not licensed, and I'm not an LCSW, but I'm a QMHP. So I do know the notice for the QMHPs hit my personal mailbox just about May 1st. So they are giving,
it's about 45 days up to, you know, a little more, maybe 60, but I mean, it's about 45 days to try to.
Yeah. So we're getting almost just about 2 months to make sure we have to put it in. And I believe, I would assume that the LCSWs, LPCs, and LCPs are the same. And I want to say, and I don't know if there's any physicians on the line or prescribers, but I want to say that I had one prescriber tell me actually that their reminders come in at about 3 months.
Okay.
But I don't know if there's anybody on here with us who could verify that. But
because
I would imagine
it's a lot. Yeah, and I started running them probably at the beginning of June, and it's just about every day I was doing the license lookup search. And the thing about it, that's why I say it's important. License lookup only lets you search so many licenses a day, so it will be a limit, and then I'll have to go back the next day and search. So yeah, it was just. Did
not know that. That's not fair. That's not right.
So it was that kind of.
So Shannon, can you pull back up to the list of services? Because I just want to make sure people see this list. Thank you, Shannon. I thank Shannon Clark. I appreciate all that. If there's anything else you want to add, go right ahead. I just want to be sure people have access. They see this list. So, and if you're falling into any of these credentials that you can identify your services there. Looks like, we have a few for the nursing staff, and then a lot of it's really the license, the LPCs, LCSWs, or, the prescribers, the physicians and nurse practitioners. Anybody else have any other questions?
Is that list available on the portal or anywhere where we can just download it?
We can make it available. Sure, we can make it available.
Great. Okay.
I'm going to put these PowerPoints in the SharePoint, and at the end of the training, Margaret is going to show everyone how to access them. Very good.
Awesome. Thank you, Shannon.
You're welcome.
Betsy, I want to add something too.
Right.
Every now and again, for some of these services, we have what's called a non-billable line in there where people can you still might be able to access the service, but it's just not going to bill it. So if you're a licensed staff, it'll still let you access the service, but it'll throw it into a non-bill status is what is going to happen.
Thank you. I forgot about that. You're absolutely right. And I think the individual treatment is one of those. You can grab that. And the reason why that's happening is we at one point had like interns, or there's, people that who are learning and are providing these services we're not necessarily billing for them. Like an intern is not actually billing for an individual treatment or family treatment or group session. They're here for learning. It's education, and they're getting supervision, but they're not billable. So we had those non-bill lines built for some of those folks. So if your credential expires, like Ray said, you're going to see it, you're going to grab it, you're going to complete it. So always double check that it's billing. When you can look at the visit details when you go to approve your service. Make sure that there's a billable line in there at the top of the visit details. If it says NB in there, it's non-billable, and you're like, oh wait, I'm licensed. This shouldn't be happening. You need to contact the credible team so we can see what's going on with that service. There could be a couple other reasons for it, but yeah, probably 75% of the time, Ray, you're right. It's going to be a credential issue. Thank you, Ray. Any other questions? All right. Well, that's all I've got for credentials. So what do we got next on the docket?
Thank you so much, Mitzi. So next on the docket, we have service members, veterans, and families. And Kanisha is going to go over this with you. Kanisha, are you ready?
Yes, ma'am. All righty. So service members, veterans, and families. Military status, the current status of an individual who is active duty, reserved, retired, discharged, or dependent military. A great way to ask the question is, have you served in the United States military, or are you the spouse of a dependent or dependent child of an individual who served in the United States military? Not applicable, which stands for no military. Military status is only acceptable for individuals who are not active duty, reserve, retired, discharged, or dependent military. The military status question is found on the client profile as well as many of our forms. The question in the form is an injected field, which means the information is injected into the client profile. Please ensure we are properly capturing our service members, veterans, and family individuals. So now I'm going to show you all how to actually change the military status of a client's profile. Let's see. Oh.
I just turned it on.
Okay. Oh, it still says you're sharing. Oh, okay. Okay, oops, wrong screen. Okay, so I'm actually going to go ahead and go to our client, our training client, to use an example. I'm going to go to the profile, and right under client info, you're going to click on full client info right here. You're going to scroll all the way down to where it has military status right here. And to change or update the status, you're going to go all the way down to, well, up here to update. Then scroll down to military status. And here is where you can actually change the status. And you can choose armed forces on active duty, armed forces or dependent guard, National Guard dependent, armed forces or National Guard discharged, armed forces or National Guard retired, armed forces reserved, National Guard or not applicable. I'm going to click on whatever status they are. Then go down and click on update client. And that is how you would change the military status of a client. So does anybody have any questions about how to change the military status?
If not changing it, does anybody have any questions at all about the military status? Any other questions about it?
It's not really a question. It's just kind of a point of emphasis that, yeah, if you do, I mean, getting that accurate, and sometimes people aren't exactly, just do the best you can with it, because sometimes people will say they're retired military, or they will say that they, you know, that they may tell you that they're a veteran. Sometimes they're a veteran and they have benefits. Sometimes they're a veteran, but they may not have benefits. So, you know, if they're retired in a retired status, they definitely should have some sort of benefits. And those are just things that kind of key us in to, you know, which way to go with a person if they are eligible for benefits. So those little details sometimes can save us a lot of head scratching and which way to go with someone. We have someone right now that we're kind of dealing with that, and it wasn't anything that, it was an outside referral that came to us, and we've been kind of spinning around wondering, because he had a stroke several years ago, and it's very difficult to get accurate information from him, and you know that, and sometimes you just have to do the best you can, and we go from there and solve the puzzle on the way, right?
Mhm. Yeah.
Miss
Thank you. What? Who is that? Who?
Lucretia,
No, go ahead, Lucretia.
I just want to confirm, I know that you had sent an email saying that when we get anybody that's military affiliated, we have to quote unquote refer them to an installation and then document. Does that also include specialty programs like, you know, PSR or TBI, or was it just relevant to SDA?
So yeah, we did send that out, and that's actually what you're seeing in front on the screen right now as well. So good question, thank you. If we do have our service members or veterans or families, we are marking people as having some sort of a military status, people who aren't not applicable. They don't have anything. It's those people who are active, they are retired or been discharged. We are required by the Department of Behavioral Health and Developmental Services, and part of our state reporting will demonstrate this for us. We are required to refer them to military treatment facilities Veteran Health Administration facilities and or the Department of Veterans Services. So we can refer them to these places, Lucretia, and in addition, we can refer them to PSR, skill building, or any other service they might need. So these referrals here for the military referrals, those are actually external referrals. And we document these on our external referral form. And if we're going to bring somebody into our own PSR program or our TBI program, or our skill building or our outpatient or whatever, say there are, we would use a universal referral. So if they're coming through SDA just assigns them to wherever they need to go in-house. And in-house, if you're wanting to, say someone comes to see you through your TBI program, Lucretia, and you want to refer them to our skill building program, you would use a universal referral to refer them to skill building, and then an external referral to make sure you documented any kind of referral to the military facilities. Does that answer your question?
Yes, ma'am. Thank you.
Okay, yeah. So
We're in the process right now, and we're hoping that we get funded for a grant in September that's going to hopefully have us working a little more hand in hand with the VA and dealing with them, acting as a safety net for them. And we've had some discussions with them, and we're hoping that that comes to being here. And basically, we want to try and you know, not everybody wants to be in the VA system. Not everybody wants to be, you know, referred, but it does, as per that message by DBHDS, you know, we will have to do some sort of referral, at least to, I found that DVS is very helpful, Department of Veteran Services. They have a good rep up there. And, you know, we're hoping that our services, as we get into this program, are going to become basically something that we can tell the VA, you know, they're under our care right now, and we'll be in constant communication with you on this person. But I'm hoping that will also act as a referral, you know, when we can let them know that, you know, they are under our care. They're either at the brain injury clinic over there or something along those lines. And the VA was very responsive to that, and like the fact that, you know, we do have all these services. So hopefully, you know, that's going to be coming into, but as per that DBHDS letter, we still have to in some way refer to one of those three. And if there's any question about it, give me a call, and we'll get them referred to DVS or the VA system. If they're eligible. They may not be eligible for, and that's one thing for veterans benefits. The VA, they have to be, there is certain things that, you know, entitle them to benefits. But DVS, we can contact them without them being VA benefit eligible. So those are things to consider too. They may be a veteran, but not be VA eligible.
thank you, Whit. So with that grant coming on board, it's going to be really even more important that we're accurately capturing who they are. So that, you know, we can be looking through the chart and you can see exactly, oh, who are they? We can run reports and we know who they are. We know who's retired, who may be discharged, who are dependents, who are active. So that's going to be really important information for your team once you get that grant. So I think sometimes we have a tendency to just kind of say it's NA. I think we do a lot of that sometimes. And what, you can correct me if I'm wrong here, but one of the things I had once been told is those folks that were discharged don't necessarily like to talk about that. And they may not always say that. So they may deny that there's any kind of military involvement. Or they may say that they've been retired instead of discharged. So sometimes it could be a little bit of sticky wicket to make sure we're getting the right information. And I don't know if there's any good way to kind of help folks navigate that with to make sure we're getting what we need.
Right. That definitely happens in a number of different ways for various reasons. And Nabi can tell you about that also. And dealing with people that they don't want to be in the VA, they want certain services. You don't know. I mean, and we wanted to talk and ask questions about the gentleman we have right now, because he's kind of been a puzzle we've been putting together due to his stroke situation along the way. And we're taking him to the VA and getting him services. So we know he has VA eligible services, but there's just a lot of other things that we don't understand about his situation, because he really doesn't communicate to us that well. So I mean, there's all kinds of things, and any doubt, with a service member, if they, some of the easiest things, I mean, if they've got a military retiree card or something like that, they're definitely, in the, they've been in the military. If they've got a VA card or a active duty or a retiree card, those are little things. And those are and when somebody tells you they're retired military, they should have a retiree card. That's one of the things you can, hopefully it wouldn't upset them, but you could just ask them, can I see your retiree card? And that way, when you see that, that kind of opens doors to veterans when they're an actual retiree, and they are recognized as such, right?
Yeah, we could, you certainly could ask to see that, if they're willing to show it, because you can say, we'd like to make sure we have this in your record, and it helps us to navigate to the different benefits that you would be eligible for. We can have that.
Right. And to your point, and I've got an aircraft coming. To your point about the accuracy of our reporting on veterans is going to become critical with this grant, and getting refunded every year at the September timeframe. So we definitely want to be as accurate as possible, and make sure we're checking all the blocks and getting veterans the referrals they need, and get them in the system correctly. Thank you. And I'm not the expert by any means on the documentation. I'm definitely leaning heavily on listening to you all and your expertise, and our crew may be calling you all a lot. But if anybody has questions about vets, please call me.
Absolutely. So in terms of like the documentation, like Kanisha had said, most of our forms, a lot of our forms have that military question on it. So you do end up answering it for every assessment every year. We're double checking it every year. And when you fill it out on the form, as Kanisha had said, you fill it out on the form, when you sign and submit that form, it pops over into the client profile for you. And if you end up updating, so let's say somebody's an active military, when they come into services, it's active military in their profile. And then, a couple of years later, you're doing a new assessment on them, and they say, oh no, now I'm retired. So when you put that new information in that new form, you answered as retired, it will add to the history section in that little question, but it will change that on the profile to retired. So you don't have to be going back and forth to the profile for some of those things. And is there any questions about this, what's on the screen now? It's just a reminder about those external referrals. We have that external referral form. Be sure you're hitting the Military Treatment Facility, Veteran Health Administration, or Department of Veteran Services items on that form, whichever one or ones, you can do multiple referrals, but whichever one you might be referring to. It had mentioned that they might decline your referral. They don't want to be referred. That's okay. For our purposes, we asked them and we said, I want to refer you to XYZ program, whether they accept that referral or not. Just make sure you put that in your progress note, but you still made a referral, whether or not they accepted it. So again, the referrals are not that I took them to the place or I downloaded an application and filled it out with them. While that may be part of your referral process in some cases, in other cases, you're handing them a business card and saying, hey, I really need you to call this place to get whatever benefit or services that you need right now. Or, I always like to say, chicken scratch on a napkin, you hear about that in Hollywood. Chicken scratch on a napkin, a producer's phone number. Here, somebody's phone number, a name and a phone number. Take this and call them. That is also a referral. So give yourself those credits. Document in your progress note whether or not it was accepted.
And that's within 30 days, correct?
In 30 days, we need to be doing that.
Right.
And if they don't get in if they choose not to accept it within 30 days and 90 days down the road, it comes up again and they accept it, document it again. You're re-referring them back to the same place. That's okay. They want it now, so you're going to document that you did it again. And that's perfectly acceptable. Any questions? Check the chat here. Okay, so Kanisha, I kind of took over for you. What else did you have around? Sorry about that. What else did you
It's
have?
okay.
I did a good job. All right, so we're gonna move on to essay problems. So all individuals open in any essay program must have a drug of choice listed in their profile. You should also ensure the clients have an essay diagnosis. A lot of times we have clients who have essay problems listed but don't have the diagnosis listed, or sometimes they may have a diagnosis listed but they don't have a problem listed. So those two go hand in hand. You want to make sure you fill out both of those areas in the client profile. When capturing essay information, please know that if you enter an essay drug of choice, you must capture the corresponding fields of the frequency and method of use. And I am going to go into Credible and show you all this after I tell you about it. So if the client refuses to tell you the frequency or method, you can also use unknown, but you may never leave those fields blank if you listed a drug of choice. So primary age of first use and date of last use are not required, but I recommend you asking the information. If the individual does not share the information, it is okay to leave the fields blank. The essay information is found in the client profile as well as in many of our forms. Again, many of our forms. So please ensure you're properly capturing our essay individuals. The question in the form is an injected field, which means the information is injected into the client profile. Remember, these essay fields are not only used to capture current essay problems, but past essay problems as well. These fields hold historical information. So this is kind of like a guidance document that I had created for some TEDS data. But basically it's just telling you that if you fill out this, then you should fill out this. And you know, that's just basically telling you what I told you on this page, but just basically giving you like a little demonstration, a little bit more information. So And the same stipulations apply to the secondary and tertiary essay problems. So I'm gonna go ahead and bring up Credible, and I'm gonna pull up my training client and show you all what I'm talking about. So here you have the client profile. So if you click on edit here, this is how you capture your essay problems for your client if you were to go in the profile. Now, again, I did tell you that when you answer this information inside the forms, these are injected fields, so they automatically fill in here, okay? So here, let's just say my client has an alcohol problem, and I say, you know, okay, what's your frequency of use? You know, how often are you drinking alcohol? If they tell me, then I can capture it here. But if they don't, it's okay to say unknown. It's not okay to leave this field blank. If you leave this field blank, it causes fatal errors in our state data that we send up to the state, okay? So then here is primary method. Okay, so how are you consuming the alcohol? Hopefully orally, so we would check that. And then these are the two fields that I was talking about that are not required. The primary age at first use is not required, neither is the date of last use, but you always want to ask. Again, if they refuse to tell you, there is an unknown right here at the bottom. This does not mean to select a whole bunch of unknowns. This means please ask and put accurate information here, as we do use this information to find out clients who may need to be linked to SA services and things like that. So date of last use, if they don't give you a date, you can just leave this blank. It's perfectly fine. So then you would scroll down here and you would choose update client. Once you select update client, those fields will be there. So I am going to go on full client info because I just want to show you, in case you don't know, all of these fields that are blue are historical fields. So if I click here, this morning I came in and created some stuff in here. You can see this is a historical field. I went from an old value of no alcohol to alcohol, and it says that the training employee did it. Then I came in my own profile and I changed it from alcohol to no alcohol. And then again, now with you all, I changed the old value from no alcohol to alcohol. So I just wanted to show you all that these are historical fields where we can see historical information about clients. Again, I did mention that diagnosis. So I did say my client has alcohol. So then I would go to the diagnosis, which is here, and then start a new diagnosis and make sure I'm adding that alcohol. And I'm just gonna pick one because we're just in training, but make sure I'm adding that alcohol diagnosis to my client's chart, okay? And I'm gonna make sure I save. Well, oh, the other thing I wanted to tell you was, when you're doing this, if your client is like an SA or something like that, receiving SA services, in here you can choose a default program for your diagnosis. And so what that means is any service you were to do in that program, that diagnosis would automatically pull in on your sign and submit page in your service. Okay, so then you would click save, which is here, and you would save that diagnosis. Does anyone have any questions? I think I did see the chat, just people checking in. Okay, does anyone have any questions about capturing SA information? I did also put a little example in our PowerPoint, but it's very important that you capture this information. A lot of times we skip through those questions and not answer them or put none just because we may not want to ask those questions and things like that. So we need to make sure we're asking all the questions that's in the forms because they're there for a reason. We definitely need to capture all of this information for our clients.
Well, yeah, one of the things I'd like to add while people are coming up with their questions, so please ask them. One of the things I want to add is these fields for the alcohol, or actually for the SA use, they don't have to be used for active current use, like someone's actively using a substance. We have clients who used in the past and are no longer using. And we can still capture that. And that's where that date of last use kind of really comes in to play. They use them as a teenager and, as now as an adult, they're not using, but we can still capture that past use. So the primary frequency, thank you, Shannon, would be maybe unknown or no use in the past month, most likely if they stopped using. And what was that date of last use? That can be, several years ago. So we want to be sure that we're capturing not just current use, but we capture past and current use. For those people who unfortunately are using more than 3 substances, which hopefully there aren't too many of those, but I'm not a substance use clinician by any means, so would not know, but that's a lot of drug use in my book. So if they're using more than 3 or have a past history of 3, then what we really do want to focus on what the current use would be. And then the second and third would become more of the history if they're, but we would put more emphasis more on the current if they're using more than the 3. But any questions? And Shannon, did you say that do not leave the primary essay problem blank and just put stuff in secondary and tertiary? If you've got something in the secondary or the tertiary, you've got to have something in the primary.
Yes, and that's where that guidance document, it goes further into details to explain that. If you have something here, it has to be something in these fields. And if there's something in these fields, there definitely should be something in this field. And that goes for secondary and tertiary as well. Jessica, I see you have your hand raised. Did you have a question?
Yes, I did. So as this relates to case management, mental health case management, I've seen by doing chart reviews that it's almost like this area is done once and never done again. One thing I've advised staff is to go ahead and update this each time that they do a review. Is there any other advice or things that we should be looking at as it relates to this?
That's great. Thank you so much, Jessica. Yeah, it is. These questions are in the assessment form, and they are filled out in the form directly. So that's the best time to update it. Double check that during the assessment. Hey, you said last year you were using alcohol or marijuana, you still using? Let's get this updated. But throughout the course of their treatment, we should be checking that as well, especially if we know that they're using. If we're just capturing historical data, we may not be checking as often, but if we know that they're actively using, that should be a focus of our treatment planning every time we contact them. And what kind of referrals are we making? And we're checking that, are you using less? Are you using more this month? Did you go to your meetings? Do you need a referral here? Do you need a referral there? And to be checking that so that we should, there should be something on their treatment plan if they're actively using, and that we're checking that every contact that we have. And then updating this as much as often as necessary when we get updated information.
Another area is the discharge summary. So that is another area where we see a lot of SA problems being changed to none, not applicable, and things like that. But then we get an error on the data end because there's a frequency of use and there's a method of use. So when we go back in, and y'all have received, some of y'all may have received emails, because we normally send an email out to say, hey, this client did have substance abuse and you've changed it to not applicable, and we tell you how to access those historical fields to correct those. But we do see that as well in the discharge summary, where some staff are just putting not applicable versus actually going back and reviewing the client chart and making sure we're putting the correct information in those discharge summaries.
Yeah, once they're done with their treatment, it's not a none. Remember, they might be being discharged because they stopped using, they no longer need our treatment, but it's capturing historical information that they once used. You would update this to keep that problem, the primary frequency, no use in past month, and the date of the last use is going to be some date in the past. I think also, Shannon, do you ever get disconnects between the type of drug and the method? Like you said, hopefully the alcohol is being orally, we're not injecting that, hopefully. So, or
Yes.
we seeing disconnects where we know the primary method of something should be oral or smoked or injection, that's really the only way to do it, but it's something different. So
Yeah,
okay.
we have those as well.
So yeah, please be sure you're getting the right method.
Whit, you got your hand raised? You have a question?
Yeah, I do. It's not really concerning this particular form, but it is. I brought up one of the people we're trying to help right now, and we referred him to DVS. His situation is kind of so confusing. Somebody came to us and brought him to our attention. He's a veteran that his situation is he had a stroke years ago, 2014. He's kind of in a loop where, you know, the information we get from him sometimes is accurate, sometimes it's not accurate. But he doesn't have insurance. We referred him to DVS back in July, and we took him to the VA on July 13th, and he had a few forms filled out for aid in attendance and for a VA pension claim. We've taken him several other places. How would we enter him as into our system, even because he's not insured? But we have referred him, and he has been through DVS and through the Veteran Administration healthcare system.
You can just enter him as a new client and use progress notes to capture that information.
Yeah, so he would be assigned to the VETS program.
Yeah.
Yeah, and then there's the progress notes in there, like you're saying, to capture all that. So if people don't have insurance, we have a lot of folks that are uninsured.
Sure, yeah.
It is not a requirement to have insurance for receiving services at the board. Now, you might have to have insurance to receive some services, but there's always something available. We have something available for most people without. So we can put them in, you're providing those peer supports, you're assisting with those referrals, you're taking him to wherever he needs to go to get things done, and document on the progress notes in the VETS program.
Okay.
And then if you're successful in getting insurance, then we'll capture insurance information and put it in.
Okay.
Great question.
All righty. Thank you.
Great question. Thank you.
Welcome. So does anyone else have any questions? If you have not already put your name in the chat, we are coming to the end. So I do ask that you go ahead and put your name in the chat so that you can be entered in the famous wheel that Kanisha is going to spin in just a little while. So I'm going to turn it over actually to Margaret, and she's going to go over how to get to SharePoint with you all. So Margaret, are you ready?
I'm ready. I'm just sharing my screen with you all. All right. So you're going to access the Credible sessions in PowerPoint. You're going to first, can you all hear me?
Yes.
Okay, that's good. You're going to first access the SharePoint by going to www.wtcsb.org, and then you're going to click on your employee portal, which will take you to the IT and Credible information, where you'll most likely see the most recent recordings of the Coffee with Credible on the right side. You're going to click on the Coffee with Credible folder, and after clicking on that folder, you're going to see the PowerPoints from the previous sessions. You can see PowerPoints to see what each session was about, and then determine, oops, you guys are in the way, which videos you may want to and need to watch. This also allows you to see all of the previous recordings. Currently the folder is empty, but as we make more recordings, we will begin to move the older recordings into the folder. And I'm going to show you all how to do that. So mine's already up, but do it again. So I'm having technical difficulty. Why is it doing that? Well, when you go here, I don't know why it's doing that. It's been working all morning. You're going to click the employee portal. And then once you go to your employee portal, you're going to go to IT Incredible Information up here. And then the second folder on mine, I'm not sure if it's going to be the same on yours, is Coffee with Credible. And this is where you can see the previous and current PowerPoints as well as recordings. And you can also bookmark this so you can have your SharePoint easily accessible.
And as you can see over here on the right-hand side, like she mentioned earlier, the previous recorded sessions are over here on the right-hand side. There isn't anything in the recordings folder at the moment, but as we have more sessions, some of these may get pushed over here into the recordings folder as we put newer sessions over here on the right-hand side for you.
And Margaret, can you click on employee documents over there on the left?
Of course.
If you click on that. And these are all different documents that folders that employees have access to. So click on the Credible Procedures folder. If you click on Credible Procedures, these are all the guidance documents and all the to-do, how-tos, I should say, you know, that we always send to y'all. You know, like, you guys will send us an email asking for information or how to do something. And we're like, sure, this is how you do it. And we attach a document. This is where it's coming from. So feel free to go in here and take a gander at all these things. So watch the old Coffee with Credibles, or to grab some of these procedures. Feel free to use them in supervision, your staff meetings. You can pull out parts of the Coffee with Credible if you need to go over that again with your staff. It's all here for you. Thank you, Margaret.
Also, really quick, Margaret, before you move off of this, I would like to add, see this at the top where it says search this library. When you're in procedures, you can type in keywords that you're looking for. So for instance, Margaret, can you type in the word task? If you want to look up task, ticket directions or instructions or procedure, click the search there. Well, there you go. It's right there at the top. So she's able to access it. Also, if she hits the search feature, it will come up in the list and it'll be closer to the top for you to access. So see how it's fourth one down for her. So you do have that search feature up there where you can use keywords to access these procedures so that you don't have to look through the entire list. I know it's a lot of procedures, but definitely use those keywords. And Margaret did mention the bookmarking. It's so important that y'all bookmark this SharePoint because honestly, the agency is using this for a lot of things, including human resources using it to access their procedures and documents as things. So I would strongly advise you all to access it. I think the first time you access the SharePoint, it's going to make you put in your Western Tidewater email and your password that you typically use for your email, which is your Windows logon. But after you sign in one time and bookmark it, you can continuously go in without having to log in each time that you go in.